Hello everyone, I'm happy to have you all this long. So first, my name is Bahati Jean-Paul. I'm a student at Southern New Hampshire University through KEPRA program, and I have been conducting a research about the contribution of community health workers program on the reduction of diseases in under 5 children. So I hope that you are going to learn more things from this presentation. And my case study was in Rugaram sector in Gatsibo district. So let's get started. So let's first see what we are going to cover in this presentation. We are going to cover motivation, problem statement, hypothesis and objectives, population, sample size and sampling strategy, presentation of key findings, problem identified and practical solution, contribution of the skills acquired to the research process, research conclusion, and recommendation. So without further ado, let's go to the first section of this presentation. The first section of this presentation is about motivation. What has motivated me to call out that research? It's a death of a young child in our village who died due to malaria case. And it was so sad because she died without going to the hospital. And from that time, I was just asking myself what community health workers do to minimize diseases in under 5 children. The second thing, it's about my personal curiosity, because I've been hearing that this program of community health workers has been designed to provide basic healthcare services to the community. And I just want to know what basic healthcare services provided to the community. These are two things that have motivated me to call out that research. Another section, which is the second, is about problem statement. So child mortality has been noticed as the biggest problem in developing countries like Rwanda, and major factors of that problem are like inadequate treatment and living far away from health centers, as well as malnutrition. The statistics shows that in 2019, the child mortality rate in Rwanda was at 35.9 per 1,000 children alive, which means that that number is very high, because here in Rwanda we take children as the future hope of the country. So that's why we need to minimize that rate. Let's move to the third section of this presentation. The third section is about hypotheses and objectives. This research was aimed to assess if the community health workers of the Rugaram sector reduce infectious diseases in under 5 children or not. The general objective was to assess the contribution of community health workers of the Rugaram sector on the reduction of infectious diseases in under 5 children. The specific objectives, the first one was to identify the types of diseases treated by the community health workers in under 5 children. The second one was to assess how the community perceives the act of community health workers on the reduction of children who die of infectious diseases. The third one was to identify the challenges faced by the health workers regarding to the delivery of healthcare services to the Rugarama community. And the fourth one was to assess the impact of community health workers on the awareness of under 5 and the community from qualified healthcare workers. Let's move on another section, which is population, sample size, and sampling strategy. The target population in this research include parents who have under 5 children, community health workers, and qualified healthcare providers at Rugarama Health Center. The total population of this research was 3,000, of whom 3 153 have been participated in this research. Sampling techniques used in this study include simple random sampling, which has been used to the mothers who have under 5 children because they have the same chance to participate in this research. And the cluster sampling technique have grouped people depending on their responsibilities, especially to the community health workers and qualified healthcare providers from Rugaram Health Center. Another section is about presentation of the key findings. I found that 80 respondents said that the community health workers can treat only one infectious disease. 40 respondents have said that they can treat only 2. 120 respondents have said that community health worker can treat 3 infectious diseases. 56 respondents have said that they can treat 4. And the 57, they say that they can treat 5 infectious diseases. The second one is about perception of the community regarding to the work of community health workers. 91.95% have said that this program of community health workers is important. 5.17% they have said that is somehow important, and 2.88 they have said that it's a continuous program because no one knows when it will end, and its perception is very hard to determine. And the third one is about challenges faced by the community health workers regarding to delivery of healthcare services. 53.33% have said that they lack of training. 33.33% have said that they have a challenge of providing and planning the services. 13.34 they have said that they have a challenge of lack of medical supply. Impacts of community health workers on the wellness of under 5 children. In 2018, the cases have seen by community health workers regarding to infectious diseases, it was 485, and they have treated 385. In 2019, for the test for malaria, the cases have seen it was 164, and the cases treated, it was 34. As well as to the cases I've seen by community health workers for pneumonia, it was 26, and they have treated all of them as 26, which shows that they have 100% regarding to the treatment of pneumonia in under 5 children. So I have found that the community health workers can treat malaria, pneumonia, and dysentery for under 5 children. I've found also another issue, which is turnover, that comes when a community health worker leaves or retires to the volunteering job, which takes a long time to the successor to get the basic, to get the training, which can help him or her to provide the basic healthcare services to the community. And again, I found that the community health workers are very important to the community because they can treat some infectious diseases like fever and malaria, and the community health workers need to provide healthcare services without basing on the time. So the problem identified and the practical solution, community health workers of the Rugaram sector have presented some of the challenges that make their work to be hard, and 53.33% have said they lack of training as the biggest problem among others. So the practical solution of this problem is to increase the common childhood illnesses training for both new and current community health workers. As you look on this picture, so the provision of common childhood illnesses prevention training could be provided with a strong tie between the needs of healthy and a non-profit organization. Then, after getting the common childhood illnesses prevention training, new and current community health workers could provide the basic healthcare services to the villagers effectively and efficient. So the contribution of the skills acquired to the research process, ethical skills helped me to respect the privacy and the confidentiality of the respondents while conducting the research. Data presentation, analysis, and interpretation helped me to come up with the facts about how the problem is affecting the society. And then design thinking skills helped me to come up with a relevant solution to the problem, and the communication skills helped me to write a recommendation part concisely and to convey the message effectively. So let's move to the last parts or section of this presentation. It's about conclusion and recommendations. So we can conclude that the community of workers of the government sector reduced the infectious diseases where they were able to treat 26 out of 26 cases of pneumonia disease in 2019. And the main challenge that hindered the delivery of healthcare services to the community is the lack of training. So for the further research, the individuals should make a research about how medical supply provided to the community health workers, because I found that there are no criteria that are based on while supplying the medical items to the community health workers. And Ministry of Health could provide regular training to both new and community health workers. And the private organization should support financially the training that has been designed by the Ministry of Health, and the community needs to participate in the healthy campaigns. So thank you very much for being attentive in this presentation. I wish you a happy life. Thank you very much.